AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, good evening. I'm Lorena Anderson, your life and energy coach, and this is You and Your Doctor, teaching you how to live a longer and healthier life. And it's being produced by AMP2 TV and proudly sponsored by All County Healthcare, where patience is the heart of their company and their business. And talking about patience, if you want somebody who is doing aftercare, not only in your home, but also helping you in someone else's home, it's so important to find somebody that you can truly talk to, that listens to you, and that gives you a level of compassion and ease. And All County Healthcare does that with ease, as I just said, and patience. They love to listen. So we are streaming live on allcountyhealthcare.com. We're also on wwnnradio.com, You and Your Doctor. And welcome to all of our Facebook friends out there who are joining us on All County Healthcare. If you have any questions whatsoever, please call 888-717-7170. They would love to hear from you. Ask for Maddie. She's patiently waiting to answer any of your questions that you might have. We also would love to hear any of your questions that you might have for our guest this evening. You can call us at 888-565-1470. So give us a call. We've got some very exciting guests on this evening, as usual. And I am so excited to bring on Marsha Teal. She's with us from Arden Courts, and that is a memory care community. So welcome, Marsha. It is great to have you here tonight.
Oh, thank you for having me. I'm very excited to be here. How are you?
I'm good. I love your energy. Oh, my goodness. You're so enthusiastic. I love it.
Well, you know, that comes from the joy that you have when you love what you do. You have it too, and I can see that. And so, you know, you love what you do, and it's really not work because it makes you happy, and when you're doing something that makes you happy and it's not like work, well, then there you go.
I know. Doesn't it add a level of joy? You know, your passion is ignited, and you just have such a great feeling about what you're doing. And you're right, it's not work anymore. It is you experiencing your life's purpose.
Right. That's exactly right. It's what I do. It's not what I do day to day. It's who I am.
Who you are,
and
yes.
because I deal with Alzheimer's and dementia every single day, it is something that is hard enough for families.
Yes.
But by enjoying what I do helps them to relate to the fact that, hey, maybe I can get through this.
Wow, that's really powerful because it is really traumatic on the family. And a lot of times, you know, even before the individual who has Alzheimer's gets to your facility, they end up being the caregivers. And it can be really, really difficult for the caregiver, you know, because it's usually a loved one, a spouse or one of the children.
Right. Caregiving is really hard, as you've mentioned before. I've heard you say how caregivers really get so stressed out, and that's why they need help from home health companies like the company that sponsors this show.
Yes.
But other than that, there's so much more that a caregiver needs, and there's so much out there for them to take advantage of as far as resources. They just have to ask, and the caregivers are so overwhelmed, I think they don't even know where to begin. And so I'm so happy to be here to try to help caregivers to understand where they go, what they do, are they doing it right?
Yes.
You know, the questions are endless, and we never stop learning. You know, as a caregiver, it's a process. It's not that you're going to just be a caregiver and know how to do everything, but it's a process.
It is a process. And, you know, and it's a learning experience because at every step happens to be a little bit different. So every single step, you're always taking that opening up again, understanding a different level of the disease,
Yeah.
and how it's affecting you, how it's affecting your loved one as well.
That's right.
So please tell us how we get a hold of you, because I really do. I feel the passion, the love, the care that you give.
Thank you.
You are just absolutely amazing, and I've known you for a couple of months now. So, how do they get a hold of you?
Well, I work at Arden Courts Memory Care Community. They have 52 in the United States. I work at the Delray Beach one here in South Florida. The direct line for me is 561-498-5552. That goes right to my office. You can ask for me, Marcia Teal.
Say it one more time, just in case they're busy running to get a pen and paper.
Sure. It's 561-498-5552.
Excellent.
And anybody can call me anytime. I'm happy to talk to caregivers. You have a question about anything, even if I can't help a person right in my office or right in my community, then I'm going to not let them walk away empty-handed. They're going to have a resource to get what they need. So they're always going to have a next step, because I think that's important. Caregivers, reach out. Well, then you need to help them go to the next step.
Absolutely, because it takes so much for them to finally reach out. I noticed that a lot of times they go through a level of denial that, oh, well, maybe it's not that bad. And then all of a sudden it gets really bad, and it's overwhelming to them.
Right.
And they don't know where to turn. They don't know where to go.
Well, the best thing I can tell caregivers is to have a plan, and don't wait for that crisis to happen. You want to do your shopping, you want to go check out things, you want to get referrals from people, you want to go visit places. Don't wait for a crisis to happen, because then you're really going to be up a creek without a paddle, because your choices are going to be very limited if you wait.
Right.
And the important thing is, even if you don't use your plan and you never execute it, the important thing is to have one.
Yeah, absolutely. I totally agree. And I've dealt with Alzheimer's before. I mean, my mother-in-law had it. My godmother had it way back when, even before we really understood what it was all about. And then I have, a very, very dear friend of mine, my boyfriend, and we've got somebody in the family that has it as well. So I'm very familiar, and I know about Arden Courts. I mean, it's a wonderful, wonderful facility.
Well, we are memory specific. So when
Right.
people are looking for a place for their loved one and they can't stay at home anymore, or they shouldn't be at home anymore for lots of reasons, but they don't yet need a nursing home, then Arden Courts is where they can come, because it's right in the middle. And it is an assisted living, but specifically a secure assisted living, where they're going to get special care, because all the people are trained in how to deal with the behaviors, how to communicate with people with dementia. It's a special person that takes care of your loved one, because they have the experience to do it. And so Arden Courts prides themselves in being the expert.
Well, that is absolutely wonderful, and I am thrilled to have you on here this evening. That is just absolutely wonderful, because, people need to know where they can turn to, and just the ability of you, giving out your telephone number and giving them the ability of being able to speak to them no matter what, and no matter what question. I mean, if you have 80 questions whatsoever, please, by all means, give Marcia Teal, I want to say that correctly.
Marcia.
Yeah, Marcia. Give her a call. And please remind us what your telephone number is.
Okay, so it's Arden Courts Memory Care Community, 561-498-5552. Please call me if you have a question about anything related to dementia, Alzheimer's, caregiving. No obligation. I'm here to help. I want to be a resource, and I love helping people.
That's absolutely wonderful. Well, thank you again for being part of our program. I want to take a moment and say thank you, all County Healthcare, for bringing on these professionals so that we can be educated. Because many times what happens is that we don't know where to turn. We don't know where to go for the answers. So it becomes really, really difficult to be able to find those individuals. And so we appreciate that.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach, and this is You and Your Doctor, teaching you how to live a longer and healthier life. And it's presented by AMP2 TV and proudly sponsored by All County Health Care, where patients are the heart of their business. So we have another guest. I'm really, really excited. This guest has come on, and it is really very, very interesting what our next doctor does, and I'll let him talk to you all about it. Hello, welcome.
Well, it's my pleasure to be here very much.
Dr. Parita?
Yes, I'm Dr. Parita. I used to, I still do orthopedic surgery, but basically what I do now is I basically use stem cells to get patients better. So anything I used to do in orthopedic surgery, I now use stem cells and stem cells from the patient to get them better. This has been I've been doing this for about 12 years. When I started doing it, people were throwing tomatoes at me, and guys were saying I was crazy and stupid. These same people say, "Hey, can we come and spend a few days with you and kind of train with you?"
Oh, wow!
So it's kind of come around in full circle, which I kind of feel vindicated.
You know something? You're very right. Anytime you introduce anything new, though, it takes time for them to settle in and realize that there's real value to this. And from what I understand, it really, really does help, especially with the pain level. Maybe you can speak a little bit more on that.
Well, the pain, realize one thing. Everything that we deal with in medicine comes down to basically dealing with stem cells. Well,
I did not know that.
Every condition in medicine is an imbalance of what we call growth factors, which are cytokines. Now, what are cytokines? Well, cytokines are basically, unfortunately, the audience can't see, but I can go into my vest pocket and pull out my cell phone. And that's the body's cell phone system. This is how cells talk to each other. Now, your physician, he may give you medications, but ultimately what these medications may do is they may stimulate certain growth factor pathways that will cause these cells to do certain things. That's what we want to do. We want to coach the cells. Now, I've been doing medicine for 35 years. I've never gotten a patient better. Isn't that kind of an odd saying for me?
Well,
why is that? Okay, because I have a slide. I lecture all over the world. Next weekend, I'm going to be heading to Beijing and Shanghai. But I have a slide. Cells, not the patient. Excuse me, cells, not the doctor, get the patient better.
Right,
Okay,
right.
so I can coach the cells, but ultimately I have to help. I have to help the cells get you better. It's not me. It's the cells that are going to get you better. Your own cells get you better, no matter what. Every field of medicine, it's the same thing. Now, you were talking about pain. Pain is basically, there's three culprits that cause pain. There's something called interleukin-1, interleukin-6, and tumor necrosis factor. Very technical terms.
Very
But
technical.
these are basically bad guys. These are growth factors that cause you pain and discomfort. So our job is to try and see if we can nullify the effect of those things. So yes, indeed, we can help. And ultimately, people see me because they're in pain, either with their shoulder, their knee, their hip.
Yes,
And
yes.
ultimately, that's our goal, to try and get rid of that pain.
Excellent. Now, something there is that. I won't say it's a myth, but there's kind of like a rumor out there with the stem cells, and sometimes, people have a lot of questions about it because they're thinking that it might be embryonic stem cells.
Correct.
So could you expound on that for us, please?
It's a big stigma about it. It's very interesting. The first president who knew stem cells were going to revolutionize medicine was Ronald Reagan. Okay?
Wow.
Believe it or not. Okay?
Yes.
Then George Bush II came along and talked to the scientists. Tell me about these stem cells. And they said, well, these embryonic stem cells probably aren't going to really do the trick for us because we can't control them. They're renegades, okay? They're like terrorists if you put them in a body. So he says, well, okay, fine. Let's kind of restrict the use of embryonic stem cells only. Let's see if we can encourage the use of regular stem cells. So all the stem cells I use come from the patient.
Oh,
okay. They're the
okay.
patients. Now, what are the
Okay.
sources of stem cells? Well, believe it or not, we get some stem cells from the bone marrow.
Okay.
There's some stem cells in your blood. And another very rich source of stem cells, believe it or not, is your fat. Your fat is loaded with stem cells.
Get out.
Yeah, we use fat.
Here I keep trying to get rid of it.
Well, it's interesting. You never can get rid of fat. You can lose weight, and all that happens is your cells get smaller in size. And if you gain weight, they get bigger in size. But you don't really change the number of fat cells you have unless you have a liposuction. Realize when you have a liposuction, you may be throwing away very valuable cells.
Wow, that is very interesting.
So we use, on
Okay.
most of our cases, almost most cases, we end up using some fat in some way, shape, or form, in addition to other things.
Excellent. So what do you do after you extract the stem cell from your patient? What then happens?
Well, okay, I have a few clinical assistants that aid me.
Mm-hmm.
Sometimes we have to centrifuge it, which is basically we spin something around at a very high speed, and that'll help separate out stem cells from other products that we don't really want.
Okay.
Sometimes we want to treat certain cells with special LED lights or laser lights because that can activate them somewhat. And basically we get everything prepared so I can inject them back into the body the same day. Now, people say, well, what does the FDA think of this? Well, the FDA does not approve stem cells. And what do I mean by that? The FDA's job is basically to approve medicines. However, the FDA says, listen, we don't regulate the practice of medicine. If you want to use stem cells, we're okay with it, but you have to follow our rules. What are those rules? The same day, the same patient, the same facility, the same procedure. And the real key is they don't want us to manipulate your cells. They don't want me to start growing your cells in a lab because they say once you start changing the characteristics of these cells, you've now created a drug. You now have to go through all kinds of drug trials. So what we do is pretty much in conjunction with the rules of the FDA.
Uh-huh. Very interesting. Wow. Okay. So after you create, what is it, kind of like a soup or whatever?
That's a very good term. It is a soup. And, when I lecture to the docs, I say there's not just one stem cell. They say, what's the most important stem cell? I say to them, well, what's the most important instrument in the symphony orchestra? Well, no one can say because everything is important.
Right.
Same thing with your cells. It's a whole conglomeration, a whole cornucopia of cells that we use. We do make a soup, and we'll inject various types of cells into the joint and let them do their job in there.
Uh-huh. And where do you, what type of individual do you usually see where you're using the stem cells?
Well, it can be, I just had last week a couple of NFL guys that were on bye week. So we do those people. Then we also do people who are 80 years old. So it's a whole conglomeration of things. Many of the things we treat, pretty much any orthopedic condition, given the right circumstances, is a candidate for stem cell treatment. So, but not everybody. There's some cases I say, look, I can't help you. Other cases I say, I think we can help you quite a bit.
Okay. What's the difference? What makes the difference?
Well, it's kind of doing this for a while. You can see, as we get older, we may have a little more difficulty having it succeed, but we have tricks to do that. But it depends. If I have somebody with a bad arthritis of the hip and they have very little motion of the hip, I'm probably not going to help them, okay?
Gotcha.
If they have back pain, I can probably help them. If they have severe pain going down their leg, probably not going to help them. So there's little nuances that I look for to see. If I have somebody with a very bad deformity of something, I'm not going to, make them better. And one thing I will
Right.
say, we don't cure anything with stem cells. We get people better. Okay.
Okay.
The other thing that I want to tell the audience, if you go online and you see a website where they're treating everything, I have a saying, when someone's treating everything, he's treating nothing, because you can't treat all these different afflictions with stem cells. We just don't have the ability to do that yet. Musculoskeletal things are very easy to treat compared to some of the other things because of a couple reasons. We can get the cells to the area fairly easily, and the cells will stay there. So that's why we have a big advantage. That's why most of the real good progress is being made now in the musculoskeletal field with stem cells.
Well, how do we get a hold of you? Please tell our audience how.
Well, you can get a hold of me by calling me at my stem cell office. That number is 561-368-1880
Okay, great. And where are you located?
in Boca Raton.
Okay. On what street?
Actually, 200 Glades Road, but it's actually at the corner of Glades and Boca Raton Boulevard.
Oh, okay. Great.
Okay.
Yes. So let's continue the discussion, okay?
Sure.
Because you've been in this business for a long time. One of the things that I always like to ask is, is it covered by insurance?
Not at all. Okay.
Okay.
Insurance thinks that this is kind of still experimental. But interestingly enough, I have a couple of insurance companies approaching me and I says, listen, we'd like to talk to you. We'd like to see if we can at least do a pilot program to see how we would have patients do instead of a knee replacement. Now, they're not doing it because they love the patients. They're doing it because they know the bottom dollar.
Yeah.
I mean, we can do a stem cell procedure for probably maybe a tenth of what it can maybe cost them for a joint replacement in a hospital and things like that. So that's what they're looking for. But right now, it's going to take some time. But right now, these procedures are not covered at all.
Okay. So can it be a bit pricey and everything?
Well,
for the
I can tell you
patient?
exactly. There's no point in beating around the bush. Our prices can be anywhere from $900 to the most expensive thing we do is around $7,500. And that would include a couple of different joints that we would treat it at the same time. And that would be a couple of different injections spaced at different time intervals.
Okay, and that was my other question is how many times does somebody have to come to see you to start getting results?
Sometimes a very simple thing, we can treat them one time. Sometimes with a bad arthritis where they have bone on bone, they'd have to probably see me 4 different times, and maybe each time is spaced about 4 to 6 weeks apart.
Okay. Well, I've got to tell you, I've heard nothing but really good reviews on people that have decided to use stem cell, and I've also heard that might be one of the things that you want to consider before you end up deciding to do a joint replacement.
Correct. Well, the good thing about stem cells, we don't burn any bridges.
Yeah.
If a stem cell procedure doesn't work, you're still perfectly okay to get a hip, knee, shoulder replacement, whatever you might need.
Oh, God. Okay, that's very, very interesting. Because I have one of my clients, and he's got a problem with his knees, and I keep saying, okay, I have these doctors that can help you. You don't have to continue going through pain like this. And he's a hiker, he does his cardio, he works out all the time. And I think he's like, I don't know, 74 or 75 now. And I'm like, you don't have to live the rest of your life in pain.
Correct.
See one of my doctors. And especially, a gentleman such as yourself who's been in the business, a professional that's been in the business, that knows this like the back of his hand. And he's resistant. He says, oh, no, I've heard that you wait until you can't take the pain anymore, and then you go get it done. And I said, you don't have to deal with that at this very moment,
Well, that was the old philosophy for a replacement of a joint. Wait until you can't stand it and come and have it replaced. I say, look, if it bothers you enough, have a procedure done, stem cell. The other interesting thing is we do everything under local anesthesia.
Oh, okay.
Much more of a safety factor there. Local anesthesia is a very, very safe thing. Anytime you start doing anything else with sedation, you run the risk of other complications.
Gotcha. Yes. So, so that's my advice. I'm like, you don't want to wait until you can't walk anymore. Because, first of all, if you wait that long, the body takes longer to heal. So you're going to space it out another 7 or 10 years. It's going to take even longer. And why would you want to be in pain for 7 to 10 years?
Agreed.
So I'm always talking to him. I'm like, you've got to come in because this technology is so evolutionary, but it is so necessary as well. And it's opened so many great doors for the patients and to find some level of pain relief. And also, if you start with this, tell me if I'm not right, sometimes you don't even need a joint replacement.
Oh, no, I've had people out 10 years doing fine. Okay, so and, I mean they're fine. A lot of them will come back and see me for some other joint. Say, look, I want to have this done now. I think I had 2 or 3 people today actually. They said, "Yo, you did my knee about 5 years ago. Now my other knee is hurting me. Can we do something about it?" Okay, fine. Well, let's investigate it and see what's going on.
That's excellent. Does this kind of stop the aging process as well? I mean,
Very interesting what you're asking about. Okay, aging process. Okay, one of the things that we have that we use, and we're pretty unique about it because I have one of my good friends who's from Australia, who's the world's leader on this particular type of stem cell. It's something called a very small embryonic-like stem cell. Okay?
embryonic-like.
But it's
Okay.
in your body. It's your own cell. But what this does, this produces something that there's an entity there called telomerase. Not to get too technical here, but every time your cells reproduce, they lose a little snippet of DNA. And that DNA gets to a certain little size, the cell's programmed to die. That's part of aging. Now, these cells produce an enzyme that basically prevents the DNA from degrading. So you basically have slowed down aging. These cells don't really age, okay? And
Okay.
there's one cell in our body that never ages, okay? Pretty much our reproductive cells. That's why a gentleman can be 70 or 80 years old and he can father a child,
Yeah.
and that child's DNA is pristine.
Okay.
Now, I'll give you an idea how the DNA works. Remember that Dolly the sheep they cloned?
Oh, yes.
What did Dolly die from? Dolly died from old age at young age because her DNA was old. Okay?
Oh,
See, so
no,
now
I didn't know that.
Then now we get into some things. We do some certain cells that we do intravenously for aging. And these are called V cells. But it's a very specific process that we do it. Now, we've done some cases that have been very interesting in that we've taken some cells from a grandchild, given them back to a grandparent. Okay? Not many cases, but we've done a few of them, and we've had some pretty dramatic results so far.
Really?
So we're trying to push the envelope for maybe really doing some good anti-aging, not just kind of like, oh, yeah, this is an anti-aging clinic. No, we're really looking
Do you
at
have
it.
to have a granddaughter or a grandson to be
No,
able to do
we
that?
can use the patient's own cells too, but we were,
okay.
the vast majority of the time we're using the patient's own cells.
Okay.
And we give them intravenously, and these cells we've learned a trick to activate them. See, typically, these cells are an emergency stem cell supply. Only when the body's in dire straits are they really activated. But we found a trick of activating them. So that's really the intriguing thing. So one of my more exciting things.
That
working with
is
these
very
cells.
exciting. Oh my goodness, that's a huge market too.
Oh, yeah,
I
we
mean,
know it.
how many billions, trillions of dollars are spent on anti-aging? Whether it's the creams, the cosmetics, a lot of the plastic surgeons, the injectables, all that, and now you have the ability of.
Well, for instance, just you say the creams and things like that.
Yeah.
That's one of the things we make. We use growth factors now. We have growth factors that are made from bacteria, and we now make certain creams. We know that your skin, for instance, as you age, is deficient in certain growth factors. Well, now we're putting these growth factors back. Now you say bacteria are making growth factors. Well, if you have someone who's a friend of yours who's on insulin, that insulin is made by bacteria.
Yeah.
The bacteria are bioengineered.
Okay, great. I've got to tell you, that's a whole new segment there. Very, very exciting.
Oh, yeah, very much
Very
so.
exciting. I can see it now. Here we go. Oh, very. So you said that you had some really, really interesting results. Can you share with us what that interesting results are?
Well, we had one lady in particular here in Boca. She had some very bad vision problems, and we did some of the V cells. I said, look, I have no idea if it's going to help you. Dramatically better. Her ophthalmologist called me up and says, look, I want to write a paper on this now.
Oh, wow.
We've had a lot of people who have done very well with what we call autoimmune diseases. What's an autoimmune disease? It's when your body starts attacking itself. The programming is kind of screwed up.
Yes.
For instance, like rheumatoid arthritis.
Right,
Something
yeah.
called ankylosing spondylitis. I have one gentleman that works for me. He used to be on a rheumatoid arthritis medication, which has a lot of potential side effects. On TV, it's like, well, one of the potential side effects is you may get a lymphoma, which is a cancer. Well, wait a minute.
Yeah.
So he's off the medicines now. He's been off the medicines 8 months and feels great. We've done these V cells on him. So we know that they work well. We think also we've seen some pretty dramatic results in reversing osteoporosis, which is
Really?
There's really no good solution for that right now.
Right, there is none.
Well,
Yes.
so far we've seen changes on bone density. So we have some good, hard, fast science also with this.
That's very exciting. Well, I am so thrilled to have you here.
It's been my pleasure.
It's been our pleasure. You've brought a lot of interesting knowledge, and not only that, but it feels as if there's such breakthroughs that are happening now, and what an exciting time to be on Earth.
Oh, yeah.
To be able to experience
Revolutionizing medicine now.
this. Yes.
Every form of medicine, not just a couple of little fields. Every field of medicine now is researching with stem cells.
That is absolutely incredible. Please tell our audience again how we can get a hold of you.
Again, you can get a hold of me. My number is 561-368-1880. The address is 200 Glades Road, Boca Raton, Florida. We're called the Institute of Regenerative Medicine.
Fabulous, fabulous. And I want to take this time also to say thank you to All County Healthcare for bringing this professional, this expert in the field, bringing his knowledge and his wherewithal, and also, the state-of-the-art medicine that is happening now that is just changing the world of medicine. It's just absolutely so exciting. So I'd like to thank you, and thank you, All County Healthcare. And also, for our Facebook friends, if you have any questions for All County Healthcare, please give them a call at 888-717-7170. Ask for Maddie. She would love to answer any questions whatsoever. And also, if you've missed the segment and you want to get a hold of Dr. Purita,
that's correct.
Please, by all means, call Maddie as well, and she can make sure that happens for you. So we're going to take a commercial break at the moment. Again, it was wonderful to have you.
My pleasure.
Stay tuned. Don't leave. We've got another fabulous guest, and let me tell you, you are going to love her as well. So stay tuned.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met, we say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
This morning. Can
Okay,
you
you're
spend the
running.
night? Okay.
Hi, welcome back. I'm really very excited with our next doctor, our next guest. And just to let you know, this is being presented by AMP2 TV. I'm Lorena Anderson, your life and energy coach, and it's proudly sponsored by All County Healthcare, where patients is the heart of their business. Their whole dedication is to teach us how to live healthier and longer. And let me tell you, anytime you have quality of life, you have quantity of life. And that's what they're dedicated to. So I just want to say thank you, because they bring on these wonderful doctors, these great professionals, these experts who help us understand not only who we are, what we're going through, and especially when we start aging, and how to manage that, how to be educated enough, how to make the right choices, especially when it comes to your health care. I mean, we're coming into an area right now where it's open enrollment. So I can't tell you how important it is. If you haven't seen our shows before, we are archived on All County Healthcare, so you can go on there and watch the other shows as well. But we're here every Tuesday between 6 and 7. So I'd just like to say thank you to All County Healthcare. So, on with the show. We have a great guest tonight, and we have a very, very specific topic. So, please introduce yourself.
So, I'm Maureen Whalahan. I'm a gynecologist, and when I stopped doing obstetrics, I had to fill the gap with something else, and so I filled it with sex and sexual dysfunction. Who doesn't like to talk about sex, right?
We kind of talked about that. Yeah, I'm not quite sure everybody likes to talk about sex, but everybody likes to have it
today.
Yeah, they will today. Excellent. So it's great to have you, and especially for our geriatric population, because there's this stigma that you reach a certain age and all of a sudden you don't want it anymore.
Oh, that is not the case. My oldest patient who is having intercourse is 93. Her husband is 91
and it's
can
a female.
still function.
Oh my gosh.
So let me tell you, this couple is just the cutest couple around. And so it is certainly a myth that my patients in their 80s are not having sex, because they are.
Oh, I love to hear that.
Yeah.
It's as we were talking, I'm a life and energy coach. So I always coach my clients that it's so important. We are sexual beings, and it's so important for our health. Tell us a little bit why it's so important for our health.
So there are many studies out there that say that intimacy and touch is integral in survival, in going forward and feeling wonderful and looking good. I can always get an idea of who I think is sexually active in my practice because they exude an energy that is noticeable. And then
tangible.
You have others that come in and sneak it in on you. But there's lots of data that says that if you maintain an intimate relationship throughout your life, that you maintain the pelvic floor, the strength of the pelvic floor, which strengthens the bladder and strengthens your gait, the actual way you walk, and the way that your posture is held. And it's good exercise. For goodness sake, you burn some calories. So, so it is part of the wellness picture. You cannot talk about a healthy lifestyle without talking about healthy intimacy in your relationship, regardless of your age. It changes with age. So what we can do when we're in our 20s and 30s is quite different than what we can do perhaps after a hip replacement at 80. But it's not impossible, and we just learn how to adapt with the changes.
Wow, that's so exciting. That's thrilling to hear. Well, I know that when you're not only feeling better, but you're feeling alive. You're feeling youthful, and that the sexual energy is so important, in the quality of your life.
Right.
And especially at that age. So,
and it keeps all those neurotransmitters in your
Yes,
brain. It keeps
yes.
the blood flow to the brain. The dopamine and the norepinephrine and all these things
The
that start to, and
serotonins.
serotonin that start
Yes.
to settle down during depression. It settles down with aging. So having that intimacy revs those neurotransmitters up and really makes you feel alive.
Yeah, and happy and joyous. Yeah,
Absolutely.
You're right. You can just tell this wonderful energy about them. So, give us a little bit of an idea as to the age of your patients. What you end up teaching them,
Right.
how do you help them?
So I run a regular gynecology practice. So I see girls from age 10, and my oldest patient is 98. And so I see women throughout their decades. I actually now, in the sexual health side, start to see men. I take care of transgender hormone therapy. So I do a little bit of everything. But the focus of my regular practice was GYN. And then I had women who were thinking they had low desire, or that they weren't reaching orgasm or having what they wanted in their marriage. And their marriage was falling apart. And so they would talk to me, and the more I would ask questions, and then the more I was like, well, I really need to talk to your husband too, because there's some missing parts here that aren't filling in. So let me see you both together. And so I started setting aside time, like an hour visit for the husband and wife, or the couple, whatever their couple partnership was, to talk to them and get the story, because the stories are quite different from both partners.
Well, we know that, right?
Absolutely.
There's his story, her story,
And the truth is somewhere in between.
Yes.
And so after a while, I would do these articles in the Post and other places, and the writer said, you need to write a book on this. And so I said, well, I don't know. I hear this every day. And so we did. And we asked 6 questions. And what we found were many similarities across the decades. For instance, we asked women, what turns you on? what is it that makes you say yes? And whether you were 15 or 97, the answer was kissing.
I was going to say that.
Not that peck on the cheek,
No.
see you later. That deep, sexy tongue digging in there. It's just that luscious kiss, right?
Absolutely, yeah.
So, guys, women of all ages, if you're trying to get in there, you have to be a good kisser.
Absolutely.
So kissing is number one.
Yeah, no cardboard.
No.
Okay, no.
Now, for the women in their 30s to 50s, they said Grey Goose and cranberry maybe. So alcohol might be a little helpful to relax some of the stress of the day of the married women with children.
Yeah.
Another question was, what's the best sex of your life? How old were you and why? Interestingly, when you graphed out those answers across the decades, in each decade, they answered the decade prior. So the 40s said in my 30s, the 50s said in my 40s, the 60s said in their 50s, but then the 70s and 80s said right now. And I think that reflected
They're probably having it.
Yes. Oh, absolutely.
And there's no stress.
And here's the thing. They have a new discovery because now they're allowed in this generation to talk about it, to try new things, and they're finding a partner who's as open now and not quite the inhibited, I grew up Catholic, so not that Catholic in the dark with your nightie down and so forth. So right now for the 70s and 80-year-olds, however, women were quite distracted most of the time. So I think men are distressed to know that while women are having an intimate encounter with their partner, if it's gone on more than about 10 minutes, they're thinking about their grocery list, getting the dust off the ceiling fan, problems they're having, how does my butt look in this position? So
see, I can understand that, but then I also know that the guys are thinking about the same thing because they don't want to ejaculate too soon.
Well, okay, but first of all, men think they ejaculate much too soon, but in most cases, it's normal. I get calls from guys that say, how can you make me last longer? I'm already lasting 45 minutes, but I want to go longer. And I'm like, first of all, you need to talk to your girl. Because the conversations in my practice, especially in married women, long-term married women, is they would rather have 3 10-minute encounters a week than 1 30-minute encounter. So guys, listen up. Longer is not always better. Talk to your partner. It's all about the communication. Now, single women who don't get enough intimacy and they're finding a good partner, they're going to take all they can get. So going all night might be the perfect remedy for that patient. So you
of course, it's only going to be for a short period of time.
You don't know when it's going to come back next.
Exactly.
So it's really about communication with your partner and time of day. I can't tell you how critical this is for women with children. By the time bedtime comes and you've chased around 3 children all day, worked your full-time job, come home, cook dinner, straighten up, you don't even want to be looked at. You just want to lay in that bed and go to sleep. So the conversation needs to be, what time is the best? When can I approach you that you'll feel the most rested or that you'll be most interested in my approach? And what they'll tell you is before dinner, because, after eating, you feel all bloated and gassy anyway. Or late morning on the weekend. So have a conversation. No one likes to talk about it, but that's my job is I get that conversation going.
Oh, good for you. Good for you. That's wonderful. And something, I really do believe that it saves a lot of marriages.
Yes. I just wish they would come sooner. I just spoke to somebody recently, and she's been married for a long time, but they really haven't had sex for a year. So, why wait? Why did you wait a year? Why couldn't we have talked in 2 months? Because sometimes there's a lot of bitterness, and the parties start to separate to the two sides of the fence where I believe in this and I'm mad, and so I have to sort of bring that back together. But it's still not impossible. It's very possible.
What a rewarding job that must be.
It's fun. I think the most fun is when I see the couples in the room. They usually sit on opposite sides of the couch. And there's usually some pillows that they stuff down there between. And as the conversation goes on and I give each attention and everyone is heard and validated what they believe and how they believe it should be and why it's not working out.
Or how they want it to be.
Yeah. And then by the end of the conversation, there's a hand on the knee. Then they're sort of sitting next to
I
each
love
other.
that.
And by
Yeah.
the walk out the door, there's a pat on the butt
I
or
love
something
it.
else. So to me, that all that body language says the message is getting across.
Yes.
But that awkwardness when you're not talking to your partner about sex becomes such the elephant in the room kind
Absolutely,
of thing
yeah.
where nobody knows. It almost seems silly. Like when I tell people who haven't even looked at each other nicely for a year and say, you've got to start kissing, and I want the tongue to go in there. And they're like, ugh, you know.
I know.
But then I say,
Exactly.
was he ever a good kisser before? Oh, yes, he was a really good kisser. Okay, well, show me how he used to kiss you. And then they'll do
I
it.
love
And then
it.
we sort of giggle, So a lot of times what I'm doing is just giving permission.
Oh,
Yeah.
isn't that wonderful?
So it's important.
Absolutely. I totally agree. Talk a little bit, because, there's some conversation around menopause.
Yes.
Can you?
Probably the
Talk
biggest
about-
struggle. So even in the normal couple, there's something that happens with the fluctuation. First, the fluctuation, because women just become mean during that time in cycles. Thank goodness it's not steady mean; it's sometimes mean.
Sometimes.
And believe me, they don't like themselves, but nobody else likes them either. So they recognize their partner is upset, but believe me, they don't like being in their own body. So the transition into menopause is very challenging, and then the loss of menopausal hormones makes a huge impact on several factors. First of all, estrogen and testosterone, which you're losing when your ovaries stop functioning, are the hormones of sex. So you've just lost two very critical things that have been making you function wonderfully.
Mm-hmm.
A couple years later, now the loss of those hormones leads to changes in the skin, not only on the face with wrinkling and dryness all over, but in the
And
vaginal
creeping.
area. And
Creeping.
Yes, but in the vaginal area, the loss
Yeah.
of tissue causes painful intercourse, and people just ignore it because who do they talk to? Their other menopausal friends who say, I have that too.
Yeah.
So it must be normal.
So it's a big party.
Yes, and it's like,
Yay.
okay, so we're just going to avoid sex because we don't really like them right now anyway. We've already been doing this for 20 years, and So I can fix the painful sex. That is, to me, the easiest menopausal management of
Really?
low sex drive. To me, is the slam dunk because I have so many remedies for those patients, whether they take hormones or not. There's remedies. In fact, there are more and more bits of data out there telling us and giving us ideas on how to help our patients. It's not just all in your head. It sort of is, but not really.
But it's physical too.
It is
It's-
physical.
It's
So, the hormone fluctuations, address the painful intercourse, and most importantly, don't accept the decline in function as okay, because
good
we
for
can
you.
reverse that. And there's lots of evidence that when you reverse diabetes and you reverse metabolic syndrome and you bring down the cholesterol levels and you get the hormone levels normal, that not only do you make the patient healthier and reduce their risk of death from cardiovascular disease and everything else, but you improve their sexual function. There are studies that people with sleep apnea, where they've got a condition that makes them not sleep well because they keep waking up because they're not breathing.
right.
That just getting them on a CPAP mask can improve erectile function in those men within 1 week of using a CPAP mask.
It's just hard to kiss them.
Well, and they're ugly. Those are ugly. Yes, we have to do something. We'll have to decorate it in some way or sneak it off to do the kiss. But you're right. You have to do the kissing before the mask goes on.
Exactly. Well, that's really interesting.
So there's lots of health connection to sexual function. And when the sex is not functioning right, it starts telling us to beware of something down the road.
Very interesting. So what are we to be aware of if sex is not functioning?
So, for instance, men in their 40s, or hopefully not men in their 30s, but even so men in their 30s, especially smokers. So smoking is the absolute killer of male function.
Yeah.
So if you
Female
want to
function,
continue
too.
to smoke, you are going to lose your erection. Okay, it's just going to happen. When men start having erectile challenges, even in their 40s, where it's not as reliable, it goes but it doesn't stay up long enough, or it's not as firm, that is an early indicator to heart disease down the road, cardiovascular disease. Sometimes you're getting a 15-year window to what's coming. that is your opportunity to not only intervene for the immediate problem, which is the sexual problem, but also to say, we need to look for cardiovascular risks and fix them. Diabetes is another one. Do not eat so many carbohydrates.
Yes.
Your type 2 diabetes is your appetite. It is what you're eating in your diet. Give up the starches and the sugars for the most part, 90%. Yeah. And you will maintain
and start exercising too.
And exercise to burn off that extra sugar.
Absolutely.
Because diabetes is a real killer for erectile function in men, and it's very hard to manage those guys. We have to get more drastic with injections and other things to make it work. So don't get it in the first place. Yeah. Women suffer a little bit from diabetes and heart disease. They have a little harder time getting an orgasm. But for the most part, we tend to function well because there's not as much blood flow that's required to get us to function properly. Correct. Most of the women are impaired by what's going on in their brain.
It's psychological.
Busy brain, right?
Yes.
So maybe put a blindfold on. So if you put a blindfold on, sometimes it unwinds the brain and helps you relax and get in the moment of whatever your partner.
A little role playing or something, right?
Oh, absolutely. I got all kinds of ideas.
I can only imagine.
But really just shutting down the busy brain in whomever has it. It's often the women, but it's not always. Sometimes I have doctors come in and it's the doctor that's still thinking shop and can't relax and be with his wife.
Yes.
So,
and I teach people how to quiet the mind, how to turn, find that on-off switch.
Yes.
So that they can be present in the moment, so that they can feel again.
Mindfulness.
Yeah, because as soon as they go back up into the head, they're not feeling their body any long. They lose that connection.
They sabatage themselves.
Oh, yes, they do.
Women, we all do it. We know when we're doing it. And then they take that responsibility like there's something wrong with me. And then the partner says, yes, I believe there's something wrong with you.
Why don't you go see somebody?
No, right, exactly. So the conversation is always, I'd like to see you together as a couple because, and sometimes I have to get the guy to come along. I have to say, can you please come in and help me understand her better so that I can make her function better in your relationship?
That's almost like a reverse psychology, right?
Absolutely. It works every time.
That is fabulous. That is fabulous. So, I do know that there's a particular little city, shall we say, that is located in Florida.
North Florida, sure, the Villages.
The Villages.
Of course.
I don't want to mention anything, but I heard that has become quite active.
So it's always good to have your neighborhood be the one that all the people who are active sexually come to, because it only fulfills everybody's dream to have more neighbors that are sexually active or willing.
Yeah, and Viagra sales have gone drastically high, too.
And let me tell you, that stuff is expensive, so you got to have a few bucks to afford that these days, because most of the stuff that's on the internet is counterfeit. Beware.
Be very careful.
But yes, there are communities. But I lecture locally in Wycliffe and Baywinds and these other communities that you would think are traditional senior communities. But these winter residence clubs, let me tell you, these are an active group of people in their 70s to 90s.
Oh, my goodness.
And they just want to learn how to please their partner. If women learn one thing, it is that the goal of their partner is that the partner is always trying to please his lady. Aww. That while he seems self-centered in some of the approach, he's always trying to please his ladies. And ladies, stop thinking about what you look like naked.
Oh, yeah, absolutely.
We are our own worst enemies.
We are.
The breasts are sagging a little bit, or the boob, the belly is a little too fat, or whatever. Get off it. If you don't like it, fix it. But realize that your partner is like Shallow Hal. When it comes to sex, he is totally just thinking of you as a size 6 woman dancing on top of him.
And loving every bit of it.
Exactly. So get out of your head if you're worried about your physique. He would not be turned on in approaching you if he was bothered by that.
So how do our audience get a hold of you?
So probably the easiest way is the website, which is www.bestsexualadvice.com. They can simply call my office. I also have a website for the GYN practice, which is mygynpractice.com.
Your telephone number?
Telephone number is 561-965-9559. for the GYN office. And there's a link in the queue to go to the Sexual Health Center if that's really what you're focusing on.
Well, I can't thank you enough. It has been a pleasure having you on. And,
Fun.
you know, it's so much fun. And, you know, that's what sex is all about, having fun.
That's right.
Absolutely. And not only that, that's what ends up giving you the quality of life as well. You know, there's no reason why you have to, you know, cut that part of your beingness out of your life.
Right.
So I thank you again.
My
and
pleasure.
thank you, All County Healthcare, for sponsoring this show. It's on every Tuesday from 6 to 7. We're live. We stream live on allcountyhealthcare.com. Also, our Facebook friends on All County Healthcare, we're there for you as well. And if there's any doctors out there that would like to join our radio show here, please just give us a call, 888-565-1470. Lorena Anderson. We'll see you next week.
Thank
Have
you
a
for
great
letting us
day.
share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. If you believe you can, or you believe